Hello, everybody. Nelson Berger here with Program for Wellness Restoration. Program for Wellness Restoration, or POWER, is a nonprofit that educates patients, clinicians, and other educators about HIV-related health issues and wellness, side effect management, and we advocate for HIV cure research. Today, we have the honor and the privilege to have an old friend of mine, Dr. Casavantes, Luis Casavantes. He's been a great resource for the community. He lives in San Diego, but works in Tijuana, across the border, a few minutes from San Diego. He's been treating people with HIV-related lipodystrophy, mostly HIV-related wasting of the face and the buttocks, with different products and fillers. We're going to talk about them today. We're also going to talk about, at the end, about new techniques to enhance other body parts. Not enhance, but actually, yeah, I guess that works. Enhance. Yeah. When it comes to facial wasting and buttock reconstruction, can you tell us a little bit about your background and what you do?
Sure thing, Nelson. Thank you very much for this interview. It's good to see you after all these years.
I know.
Yeah. So it all started back in probably 2001 or something like that. I didn't know anything about it. And all of a sudden I started getting young gay guys with some sort of premature aging. And I started using Restylane and things like that. And they will go very happy. And I was like, what am I doing here? I honestly didn't know a thing about it until I met this other person that informed me about this syndrome that had been described earlier a year or so in Australia, Dr. Carr. So at that point I said, okay, I've been dealing with this situation. So I did further, and I ended up, along with this person, using the only thing that we could get at the moment, that was bioalchemy, promising soft tissue filler at the time, and basically the only thing that we could offer to patients with facial wasting to return the volume lost in their faces. It was very good and it was bad. The product turned out to be not so good, and we ended up having a lot of trouble with bioalchemy. It's out of the market, fortunately, in most countries, as far as I know. And finally, we got our hands in this product that, along with bioalchemy, they were using it in Brazil, PMMA. And once we switched from bioalchemy to PMMA, in this case metacryl, we started facing a totally different approach to facial wasting of permanent fillers with very low possibilities for complication, high effectiveness. And I can tell you those patients were really pleased, and we were more than pleased to be able to offer that. This is back in 2002. Things have changed, and we don't see the syndrome anymore, fortunately. And now also we started doing procedures that were more extensive, like rebuilding the buttocks in those patients to a point that we will give a little bit of the shape back, but mostly the function. Luteal lipoatrophy can come to an extent that the patient can barely sit for normal periods of time, and replacing those the lost tissue in the region really makes a difference for the patient. And again, a product with very low possibility for complications, very low or inexistent possibility for infections, really well tolerated. Has its pitfalls as everything else in medicine, but is a great thing that we could be doing back in 2004, something like that.
So tell us a little bit more about this PMMA. What does that mean? What is it made of? Why is it safer than other fillers, not only for the face but buttocks? Is there a product like that approved in the States, etc.? Give us more details.
Yeah, PMMA, I'm going to have to speak a little bit about Bioalchemy first. Bioalchemy is a gel, and when you inject in the body, the product stays as a gel and is surrounded by a very thin membrane of collagen. The problem with these implants is that the core of the implant, being a gel, is not permeable. So there's no neovascularity into the implant. There's no way that the body can defend itself if something happens to the implant, because there's no way for the macrophage or any of the defense barriers of the body will reach the area. So as every implant in the body, Bioalchemy also creates a biofilm, and disturbing that implant of Bioalchemy with no possibility for defense mechanisms to defend, the infection goes bad, and it has to be extracted, which was one of the sell points for that product that they told us, oh, don't worry, it can be extracted. Yes, it can be extracted, but to some extent. Sometimes we require extensive surgery, sometimes it's an easy extraction. It all depends. Different from that, PMMA is, when you do an implant of PMMA, is not making billions of micro implants. PMMA is comprised by microspheres of hard plastic, which is known as PMMA. And when there are 40 microns microspheres. And when you inject into the body, the vehicle that is contained in the product gets absorbed, and the microspheres get surrounded by the host's own collagen. And there's neovascularity that grows in between those spheres, and defense mechanisms can reach the whole area of the implant, turns into a living implant and behaves like part of the body. The problem with this is that sometimes, especially depending on the area where we use it, sometimes PMMA creates bumps and lumps, which is very different from granulomas. I have seen in probably, I don't know, close to 5,000 patients that I've had, I've seen two true cases of granuloma. Granuloma is when not only a bump, that bump is inflamed, is hot, is tender, and can be itchy. You can see that there is immune activity into it, and with the vast majority of the patients, even though they can develop lumps, there's no immune response. So from the face, we went down to the buttocks when we knew that the implant was safe, and that we could use it in larger amounts. And same thing with the butt. I mean, after all these years, the only thing that we see is in some areas the product will gather, creating some sort of lumps, but there's no any other issue associated with it. There are a number of reports of accidents and things, but there's an article of this hospital in Brazil that gathered information about, I don't know, 1,000 patients with complications or something. When you read the article, it's easy to see that 99% of those complications were technique related, not product related.
So when you say technique, what does that mean?
Yeah, I will not recommend anybody to go and see a doctor that has had 3 patients with permanent fillers. Once you jump to permanent fillers, you need to have a solid background with temporary fillers. Once you master the technique of injection, then you're safer to do permanent implants. Typically, problems related with the technique are occlusions of arteries, occlusions of salivary glands, salivary duct. I haven't seen one, but there's a syndrome, Sokolov, I think is the name of the syndrome, that if you use needles in the area of the glabella and you hit this little vein, you create a flow back into the retina, creating immediate and permanent blindness. So how do we stay safe from accidents? Well, the first thing, and it is the most important thing, is to use microcannulas instead of needles. By using microcannulas that are blunt, we are going to just move the artery or the little vein when we poke through it, and it is very difficult that we will deposit any material into a vein or an artery. Whereas with a needle, it's easy to go and hit inside of a vein or an artery and deposit product there with all the consequences that it can take.
But you have had, tell us about the success stories. You've had many patients using PMMA. You said over 5,000 people you've treated. A lot of these patients, I guess, fly from the United States. Why would anybody fly to Mexico? I understand we have products here, and just to give a background to the audience, we have 2 products in the United States approved by the FDA for HIV-related lipoatrophy of the face, or facial lipoatrophy. Both are temporary. One is called Sculptra, and the other is called Noraptrofil. What is the other one? If I just completely blanked out.
Radius and
Radius. Yeah, and they're both temporary. There's another filler called Artifil, which is not approved for HIV-related indications, that is composed of a PMMA, also the same product you use but made in the US, and you use something that is based on the same compound, right?
Correct.
It's called Artifil in the United States, very expensive. So why would anybody fly to Tijuana to see you instead of seeing a doctor here in the States?
I'm blessed for that. Basically, the PMMA FDA authorized product that used to be Artifil, now is called Belafil, is 20% PMMA suspended in collagen. Physicians in the US have the restriction of the product not being approved for high quantities, high volume that is needed in a face with lipoatrophy. So they are restricted in that sense. They are restricted also in the price of the product is prohibited because of the presence of the collagen. What we use is a product manufactured in Brazil that instead of having collagen has carboxymethyl cellulose as a vehicle. Is not expensive. We can use 20, 30 cc's in a face easily. We can use 400 cc's in a buttock reconstruction, and we have no restrictions in that arena. One of the reasons why people will get on the plane and the other side of the world, we have had patients that come from Perth, Australia, or from South Africa, places like that. And why do they get on a plane and travel around the world to come and see us? Is because there's only a handful of us that do this, or that did this. There are no new cases for facial lipoatrophy correction. Anyway, back in those days, they will have 2 options. They will come here to me, or they will come to my friends in Brazil. The problem with absorbable fillers for a reconstruction is very easy to understand. You look good for a couple of months, and then you go back to basics, and then you look again and back to basics. It's very sad for the patient to not really look good permanently. And so at the end, they get tired. I had a number of patients that spent thousands and thousands of dollars and multiple visits to their doctor for Sculptra or any others, and they ended up with me looking for a permanent, safe reconstruction. So, of course, we need to deal with, unfortunately, the media that puts Tijuana in not a good place, and sometimes we have to deal with real situations there. But, I mean, we offer the safety of being an office. I will call it an American office in Mexico. I follow the HIPAA guidelines to the extent of them. I have an American nurse working there. We all speak English in the office. We have a shuttle service that will pick up the patient in San Diego Airport or any area south of San Diego Airport in San Diego, and they will bring them down to our office. If they need to stay in the area, my office is in a twin building. The other tower, the twin tower building, the other tower is a hotel. So they're safe. They don't need to, if they don't want, they don't need to go anywhere. And if they don't speak the language, if they're fearful of the city or whatever, they don't need to go anywhere. So it's really safe for them to come.
Yeah, you're very close to the border. I've been to your office. He's got, by the way, Dr. Casavantes has a gorgeous office overlooking a golf course in Tijuana. It's top-notch, all the equipment. I mean, your office is probably more fancy than any of the any cosmetic-related office in the U.S. So tell us a little bit about why. What do you tell people that say that they're risking their lives by going to Mexico or any other country for that matter? But you're definitely in Mexico, so you know your country. Instead of spending probably 3, 4, or 5 times more money in the United States. I mean, you did say that there's a restriction on the use of a product like Artifil. What's the new name that you said? They keep changing names and companies.
They keep changing, yeah.
What's the name of
Belafil. Belafil.
Mm-hmm. Yeah, there's a restriction. It's not approved for HIV-related wasting, HIV facial wasting. So it's all out of pocket. It requires, like everything else, larger volumes, but that's very costly, and there's a restriction on the volume. So beyond beyond the cost, so what do you tell those people that, because I do hear that, don't go to Mexico, or especially to your, in case of your office, it's not safe, or tell them a little bit about, besides the shuttle, how do you guys work to ensure that, first of all, if that's really a myth or not?
Well, there's definitely a myth. Many patients fear that they're going to be kidnapped. And my response to that is, don't worry about it. You're not going to nobody's going to kidnap somebody that they don't know who he is, how much he's worth, right? A kidnap is an organized situation that starts with a banking account and knowing the person and knowing how they're going to put pressure and collect a ransom, right? So a regular person faces the small crime that anybody faces in any city in the world. We have had a couple of instances of little things, both in Tijuana and in San Diego. Our patients have gone through little things. They stole the computer, they tried to get them in the street or something. So what we tell the patients is rely on our service. Don't worry, don't overly worry about those things. You need to use common sense. Do not bring any bags. Do not bring any jewelry. I mean, it's just when you go as a tourist to a place, right? You have your iPhone or your phone in the pocket. You snap the picture and you put it back, and you don't want to be carrying jewelry and stuff.
Yeah.
So, to the moment, I mean, after 30 years of experience as a doctor in Tijuana and dealing with patients from the U.S. initially and from all over the world later, we haven't had anything that will be considered a major crime. The safety of my office, well, doctor that has 30 years of experience, I keep updating and being on top of every single thing that happens in the medical field, especially in my in dermatology. I have two more dermatologists with me. I have Dr. Morales, a dear friend of mine that is very experienced in soft tissue fillers too. So we're 4 doctors in my office. We have nurses. We have a little school that trains, that does continuous medical education for cosmetricians, for nurses, and occasionally little courses for doctors too. So we are really doing this as the best that we can. And of course, there's the media that doesn't help. They present Tijuana and every procedure made in Tijuana as a scam or things like that. We need to deal with that on a daily basis. But we're successful, and we have pride in announcing that our patients are safe and happy.
Do you, I've been around for a while, and I have a group online called Post Health, Yahoo groups, and another one called Post Health also on Facebook. And bunch, I would say, I don't know, there's 4,000 members, maybe easily 10% or 20% of them have gotten help from your office. They've gone to see you. So it's a lot of built-up experience on my group. For those that really want to chat with other patients, just Google Post Health at yahoogroups.com, and you can join our group. It's a private group, so you don't see any of the chats, and nobody but the registered members. And there are many there that would help you answer questions about facial wasting and buttock wasting. But do you have patients that are willing to talk to people potentially thinking about getting their face reconstructed?
I can definitely find them. My policy is to protect the privacy and the life of the patient. I've never specifically asked if they will take phone calls or emails from prospective patients, because I think it's a little intrusive. However, I'm positive that if I send the question, I will get positive response. There are a number of, should I say, fora, or to stick to the Latin word, or forums out there like yours. You have a couple of them, and there's a forum that deals with the other issue that we're going to talk later, the great enhancement. And those are honest patients that are unbiased. I don't like testimonials, because what am I going to put out there? The good testimonials, not the bad testimonials, right? So I don't really believe in it, but I can certainly do something about it.
If anybody is I think the side effect profile so far, PMMA, has been pretty good. I mean, you've been using it since 2002. We've if I was to hear horror stories, I would have heard already. We had a lot of horror stories with Bioalchemy. A lot of people got infections years later. People look great. It was a great product for 4 or 5 years, and then people started having infections due to, some people got dental work and somehow it got infected. Anything, or somebody got slapped too hard. I know somebody, and actually got infected because that gel basically was not really, it was just encapsulated and any bacteria could grow in there. So we got really, really freaked out and scary. So it was made by an Italian company that really deceived not only the clinicians, the doctors like you yourself, and every other person, every other doctor in the world using it, but also patients. So that was very unfortunate. Unfortunately, we transcended that. We had many patients had to get on antibiotics and extractions. So and some of them had to get reconstruction back with PMMA, and it's been years. So it's definitely gone over the 5-year mark, for safety. So we all have learned the hard way in this field of lipoatrophy. And now gladly we're in a better space. Not only in a better space because it's not happening as frequently because we don't use ACT and D4T, the two drugs that really cause this problem. So that's, and the second issue is basically that a lot of the new HIV-infected patients never get exposed to these drugs. So let's move on. First of all, before we move on, how can anybody get a hold of your office? What's the best way to contact you?
We have a dedicated patient coordinator. Her name is Diana, and she is perfect. She's my perfect assistant. She, so far, in years of working with her, we haven't had any issue that I could blame her, like forgetting a patient at the airport in Tijuana or in San Diego, anything like that. So Diana is the first line of contact, and she's available all the time at info@avantiderma.com. We also have...
Can you spell the website, please?
Yes, info at Avanti, AVANTI, Derma, DERMA.com. Avanti Derma.
We'll be listing it in the description of this video on YouTube also. We'll be listing the links. Okay, so you want to move on to the other hot topic that very few people know about. It has nothing to do with HIV, or it has nothing to do with lipoatrophy and facial wasting or buttock wasting.
Right.
You're specializing on is a very delicate subject that some men are willing or not willing to talk about. So let me go for it.
Right. One thing led to another one. So we started with faces, and then those patients with facial lipoatrophy needed the buttock reconstructed, and then cosmetic, especially ladies, came for buttock augmentation, the cosmetic version of the reconstruction. And then when I started doing more and more PMMA, I went to Brazil and saw this wonderful plastic surgeon there that taught me the best technique to use fillers, Dr. Nakul in Porto Alegre, Brazil. So I'm very proud to be a product of two gentlemen that are the best in this field. Dr. Nakul in Brazil, who came up with the technique, and Dr. Gottfried Lemperle from Frankfurt, that is the mastermind behind PMMA. So being in Brazil, I was taught this technique to enhance the penis by giving it more girth. So I took it. I was great. It's a fairly easy technique, especially when you master the fillers in other parts of the body. And I learned the technique, and I started offering it in my office. This is 2007, beginning of 2007. And I will get a patient, I don't know, once in a while, probably a couple of months or something. And all of a sudden, patients started coming on a daily basis, kind of like what happened to us with facial lipoatrophy in 2002. I was in 2007, every request was for girth enhancement. And then we were approached with from the coordinators of this forum to ask who we were, because it was a revolution in that forum. And all of a sudden I had my office full with guys that want to be bigger. And we're
talking about girth. We're not talking about length.
Yes, exactly.
Okay, I'm sorry.
Yeah, it's all girth. It's all girth. And well, in all of a sudden I'm doing nothing but penile girth enhancement. And it's been that way up to these days. I mean, I still see older patients that still have lipoatrophy. We have no new patients. I don't think we have had a new patient for facial lipoatrophy in the last probably 5 years. And it's a very fortunate thing, because it was a horrible thing. You and I lived that, and it was not nice. So now it's a little more vain. It's a little more. It doesn't bring the satisfaction that the other thing did, because this is another stuff. This is a personal desire to feel better, to be more manly, things like that. It's very interesting though, because of the possibilities that are out there. We, of course, I'm totally biased here, but we offer something that is safe and that won't destroy the penis of the patient. There are some, and there's an FDA authorized prosthesis out there that is giving patients a lot of complications and situations. So we offer a more moderate result, but is permanent, and it is as this falls. I mean, there's a very easy way to explain this. The skin of the body, the skin of the face, has a thick coat of subcutaneous fat tissue. When you go on and deposit a filler there, the fat tissue, which is soft, helps the implant to be camouflaged, and results are very soft and very nice. When you go to the penis, you have underneath the tunic albuginea, which is hard, and then you put the product there, and then you have only the skin on top. So there's no fat tissue that will help us make a soft, smooth implant. So imperfections are quite common. And again, I wouldn't see a doctor that hasn't had thousands of patients and a lot of experience to do fillers, because otherwise I have had friends of mine, doctors, that they see the technique and they go like, oh, this is a piece of cake, and that they go and do themselves, which is easy. The results are terrible. Because after, in the case of patients for girth enhancement, we have had probably 1,500 of them. Yeah, and 1,500, and they do 2 to 3 procedures each. So we're talking about easy 3,000 procedures. I just published.
So let me. I'm sorry, I interrupt Master Wild just because I'm a moderator here. So basically, these are men that they want to have a thicker penis. I'm going to speak now plain English. Then they come to you and they get injected on 2 injections, 1 each side. Is that how it goes? And then they come back for 2 touch-ups sometimes, like a few months later. Is that how it works?
Yes. Yeah, we do. The injections are done under the skin, between the skin and the erectile organs. So we don't touch them. We don't create any issues with erections or ejaculation, urination, nothing. Those areas are safe. And we do the implant in a U-shaped way. So we keep the area of the urethra free of product. So we don't interfere with ejaculation and urination. So we put kind of like a shield around it, keeping the bottom of the penis, the ventral area free of product. So we go from the neck to the base of the penis.
So what happens? So you don't do anything with the gland, with the head of the penis, do you?
No, this is not possible. There are doctors that do it. I still cannot imagine how, because the glans is the projection of the corpus spongiosum, and the glans is covered only by a thin mucous membrane, and immediately underneath you will find the cavernosum, the spongiosum body, which is the vascular system. So once you inject something underneath that small thin mucous membrane, you're basically injecting into the bloodstream. So we don't do anything with the glands. It's not physically possible to do it. What I think doctors that do that are creating is they're depositing that product into the spaces that are normally filled in with blood during an erection. So we keep the glands totally away from the product, and the fillers are injected again from the neck to the base of the penis.
So somebody gets a thicker shaft and their penis head is small. Wouldn't that look like a corn dog? Just to use a very crude analogy.
Yes. Yeah, there are penises that are shaped in a perfect way to receive an implant. Those are the mushroom-shaped penises, where when the glans is way thicker or wider than the shaft. When we have patients that have a missile-shaped penis, that from the middle of the penis to the tip of the glans, they taper, those patients are very difficult because we cannot make too much of a growth, create too much of a growth without unbalancing the penis. Same thing with the,
let me stop you. I'm hearing some background noise. Is that your connection or is?
Probably. Let me see. Yeah, let me try.
Yeah, there's some background noise that probably will get in the way of the video.
It's safe now.
Is it a dog or is it somebody?
No, somebody came in the room, but
okay.
Yeah,
no, anyway, so let's go. We were in the middle of a really intense discussion on dial shape and mushroom heads. So tell me just basic information when it comes to girth. I mean, I hear that large girth is 6 inches. I mean, that's measuring the whole circumference. That's what some guys basically say online. So what is a girth change, average girth change in most of your patients?
What I'd like to offer is quite different from the expectations of the typical patient. I call the procedure girth enhancement, not girth augmentation, because the last thing that I want to do is to create corn dogs. Typically, a penis that gets an increase of 1/2 inch is a penis in circumference. It's a penis that still keeps the natural shape and is substantially thicker, but still looks like a penis. Once they want over 1/2 inch, I go like, okay, it all depends on the length, because the last thing that I want to create is a tuna can.
A what? I'm sorry?
A tuna can.
Okay, yeah.
Right? A small penis with a lot of girth that's not good. So 1/2 inch will be good for average to above average patients. Less than that, I would say 1/4 inch for people that are below average. But again, this is what I offer, but this is not what makes my patients happy. Most patients want 1 inch. And I said, okay, I can give you 1 inch, but you need to be aware that the implant is going to be seen, and the implant is going to be palpable, and imperfections are going to go higher. So, interestingly enough, most patients are happy, even when they have imperfections, but most patients are, yes, I want 1 inch, and I'll be happy with it.
And when you say imperfections, what does that mean?
Imperfections are basically, we can use, our product comes, the non-absorbable product comes in 10% and 30% concentrations. What I like to do is a thin coat of 10%, and then they come back for a second session. I do another thin coat of 10%, and small imperfections like little bumps or little voids can be easily corrected. Patients want 30% in large volumes. So I go like, okay, I'm going to do a coat of 30%, but imperfections are going to be more noticeable, voids and lumps. And correction is a little more difficult. So, but you will gain more. So it's a catch-22. You need, the formula is, the bigger you go, the most imperfections you face.
So for somebody well endowed with a mushroom head, you would be able to put more volume.
Yes, definitely.
So
And circumcised.
Circumcised.
Yeah.
What happens to the uncircumcised?
Uncircumcised is a real challenge. Uncircumcised penises, we need to deal with a foreskin that has to remain functional, right? That can be pulled and that can be, so they can clean and everything. And the other thing that we face in a penis, in an uncircumcised penis, the movement of the skin is almost 100%. If you mark the edge of the foreskin when it is in its normal position, and then you pull it, it's going to go almost to the base of the penis. So that movement of an uncircumcised penis makes the implant really, really difficult to settle. They go home, that thing moves back and forth, and the implant ends up really, really irregular. And sometimes if we use too much volume, we can interfere with the function of the skin, the foreskin, and cleaning and stuff is difficult. So the ideal patient is a patient that has kind of like a mushroom shaped penis, and that is well endowed, that is average or above average.
Yeah, so definitely your niche is the United States. So Mexicans have it's pretty big market. I'm so sorry to say I don't want to. It's hard not to joke about it. I'm sorry. I'm a Latino, so anyways, but so we're talking about PMMA, right? This is the same product, but a probably lower concentration that you use in the face.
Right.
Yeah, and is there any chance for infection? I mean, do these guys have to stay over a few nights in Tijuana or San Diego, or how does that work?
One thing that helped us avoid imperfections big time was to make mandatory to patients to stay at least one night, so we could see them the next day. Why? Because the implant, the next day, the implant is still moldable and manageable. They go to the hotel, we do the procedure, we teach them how to do the homework, massaging and the looking for imperfections and stuff. And the next day they come back, and typically we see that the patients didn't get something and they're doing things wrong. So the next day we go ahead and we go back and teach them, no, you're doing this wrong, do it this way, do it that way. And we have improved everything big time just by teaching the patient better how to do the post-care. As of infections, PMMA is a very unique filler, different from the rest of them. We're depositing zillions of microspheres, zillions of foreign body particles. And the first line of defense of the body is to send an army of macrophages. So if accidentally we inject a few bacteria because the technique was not too good or something, when the bacteria are growing, all the macrophages are there already. So far, we haven't seen one instance of infection. Of course, we take care that we do the best that we can with the technique. We protect the patients with prophylactic antibiotics, and we teach them how to manipulate in a safer way. And so far, no instances at all of infections.
So tell me, does the patient have a regular erection like they used to have? Is it more like a spongy? It's hard for me to talk about this without using really common crude words, but how is an erection? And we're talking about erections. We're talking about penis, so we have to go all the way. Is an erection the same? Obviously, it's thicker, but to the touch, is it hard or softer or the same as before the filler?
I'll go back to what I offer, the girth enhancement. If I did the girth enhancement with 10%, 2 sessions and 1 touch-up session, most patients will have a product or a final product that shows a normal penis. And most of the time, new sex partners won't notice it. One of the things that happens also with the implant is that the penis gets less retractile. So hangs better, looks beefier, looks heavier, and with the erection, if you look, I mean, if you know and you look for it, you're going to find it. It's an implant. But the newcomer that doesn't know anything won't notice it. Different from 30% in several sessions in most monster penises, everybody will know that there's something there. And you can feel it, and it's harder, and it's kind of irregular. It's something that we don't like to do.
So you basically go for the conservative approach, but there are some patients that really want to have a beer can, and they don't care, they just want a beer can.
Yep. Some patients say, I don't care about normalcy.
Well, to each his own, I have to say. Let me see if I'm waiting. Let's go back a little bit to what we were talking before, and it's related to this too. Have you seen a lot of patients that had the unfortunate incidence or occurrence of having somebody have injected silicone to their faces or buttocks or even penises? So I hear that there are people obviously legally doing that with product that obviously silicone is not approved for that purpose, right?
Right.
So tell us about the horror stories there, and have you had any of those that you had to clean up and redo?
Yes, we have had the good and the bad. Dr. Derek Jones and some others in the US developed this microdroplet technique with silicone. Those patients are good. Those patients, when they really did the microdrop technique in low volume, they're good. But when they go for liters of silicone injected even by physicians, but injected in their butts or the penis, things are totally different. The silicone is, in large volumes, is non-compatible with the human tissues, and doesn't mix with water. We're made of water, and heavy amounts of silicone will drop by gravity, being it in the penis or the butt. In the penis, we have seen a number of penises that are bell-shaped because they put. I use maximum. I would say probably 40 cc's maximum in a regular penis of PMMA. Sometimes these guys that use silicone, they put 150 cc's of silicone in one session. So those penises are non-operative. They cannot use them. And eventually they take up the shape of a bell because
it migrates basically, right? It migrates out.
With the butts, there are two possible turnouts. If they go inside the muscle underneath the fascia, chances are that the product will stay there and will not create too much problem. But when they do it on top of the fascia and the fat tissue, they go to the heels, literally. In the meantime, they create a gigantic granuloma that starts in the butt, goes in the back of the thighs, all the way through the calves, all the way to the heels. And you can see the purple immune response to the silicone oil. We have had cases that we refer to plastic surgeons for extraction, and the only thing that they can do is a liposuction and try to get as much silicone with the fat of the patient, and it turns into scars and extraction of just a portion of the oil, and the other one's still there. So yeah, it's a bad thing, and there's not much that we can do.
Yeah, we only have like 5 minutes left, and I appreciate because I really wanted to talk about side effect management, side effects, what you've seen from other products. So this whole hour, we've concentrated a lot on the potential issues. Not only, PMMA seems a lot safer, but we have definitely concentrated on what I wanted to. Let's now, for the last 5 minutes, talk a little bit about the success stories, the life-changing stories, because you probably have thousands of them, not only with the facial wasting, buttock wasting, or even penile, that you can share with us. And give us like the most memorable cases that made you feel so good about the work you're doing, and how it changed the patient's life.
There's one that it'll go with me. That memory will go with me. One day I got to the office, and there were some patients waiting, and one of them, what I saw was a newspaper. I didn't see a face. I saw a newspaper covering a face. I said, "Good morning." He didn't respond. When his turn came, he was put into the treatment room, and he was wearing a thick beard and big glasses. So he was hiding, basically. And he had lipotrophy for level 4. He was communicating to the bare minimum, yes, no, basically that. So we decided on what to do. I started the procedure. He was totally quiet through the treatment. And by the way, with PMMA, the first treatment, we probably get an 80% reconstruction of the face. So it's very noticeable. It's way more noticeable the first time than in subsequent sessions. So I finished the session, and the guy continued to be quiet. I handed him a mirror, and without saying one word, he looked at the mirror, and he went like, and started crying. And not to mention, I was doing the same thing on his side. And so he left, very happy, and I was very happy and very touched by the situation. A couple of months later, he sent me an email to thank me, because he says that the reason why he went to see me, or he looked for help, he ended up with me, but the reason why he looked for help is because one day he was walking in an aisle in a supermarket. He turns, and at the moment this kid is running that aisle, and when he saw little kid saw him, he stopped and started crying, looking for the mother. So at that moment he said, "I need to do something," and he found me and he came. Well, by the time he sent the email, he was back into his job, and he was seeing friends, and he was out in life. So that's a really touchy situation that I have with this patient, and I have many more. With penises is weird. Last week I turned down a patient that told me that his life depended on his penis, and I'm like, I'm not gonna touch it.
Was it a porn star?
Probably, I don't know. I said, I'm not gonna touch it. Yeah, you.
That's, yeah.
You need to see that thing as what it is, and do not put your life into my hands in that way, right? But yeah, we have a lot of patients that say, "You changed my life." I was able to bring new life to my relationship. We were retired. We've been together for 20 years, something. So there are a number of patients that are happy.
Well, I appreciate your candid sharing with us, especially the potential side effects of different things, especially not only the ones that you use, but the ones that the horror stories you've seen from other products and doctors that are doing work that may or may not be as good. Tell us again how to contact you, and before we say goodbye to everybody.
Yep. I have created an informal network of physicians. I know, like, let's say Dr. Piron in Florida. You have helped us finding doctors that help us in Houston, and I think in Austin too. And we have located physicians throughout the country. So especially with bioalchemy, again, with PMMA, we have no problems, but we have help closer to the patient that we are. And so anyway, thank you very much, Nelson. I really appreciate this opportunity. You are great, and you've been around for many years, and I hope you will continue to do so. The way to contact me the easier way to get to me is Our phone number, we have American phone lines in our office in Tijuana. The numbers are 619-308-7268 and 308-7269. My website is avantiderma.com, and our main email is info@avantiderma.com.
Yeah, I guess we can see your logo. Pull out your shirt a little, so Avanti Derma. Okay, there you go.
Right.
Well, thanks a lot. Appreciate it. Everybody stay tuned. We have videos coming up every week with different doctors and experts. And so I want to appreciate Dr. Casavantes. You can actually either join the post-health group that I moderate and ask questions there, or email Dr. Casavantes directly at info@avantiderma.com. So thanks a lot, and we'll see you soon.
Thank you very much, Nelson. Big hug.